When it comes to helping a person whose heart is stopped, there are two important things you can do. One is to give CPR, or cardiopulmonary resuscitation. The other is to use an AED, or automated external defibrillator. These two steps could help you save the life of someone you know, even a loved one. We'll show you how to do both. But since it all starts with learning CPR, let's take a look at what a complete sequence of CPR looks like.
Hey, Sonny. You almost missed me. I was just about to lock her up.
Oh, that's okay, Mr. Trnashik. I've still got to whip that office of yours into shape.
You know me too well. You have yourself a good night, okay?
Thank you, you too, Mr.
Sonny? Sonny, are you okay? Here, you know. Sonny. Sonny, are you okay? Miss Ford, this is Coach Trnashik. I need you to call 911, send them down to the gym office right now. Mr. Owens has collapsed. And send the AED right now, too. I'm gonna go ahead and do CPR, okay? All right, bye. Okay.
Doesn't look so hard, does it? Well, get ready, because your instructor will now pause the video so that the first person can get into position to practice with the mannequins and learn the skills of CPR. When someone's heart stops beating, blood stops flowing through the body. CPR can help keep a victim's blood flowing until other medical care can be given. One of the most important parts of CPR is compressions, pushing hard and fast to get blood flowing to the heart and brain. For adults, you'll press down 1 1/2 to 2 inches with each compression. After each push, release pressure on the chest to let it come back to its normal position. This lets blood flow back into the chest. It's important that the victim is lying face up on a firm, flat surface so that you can push hard and fast. So let's practice pushing on the chest. You'll learn the other steps to go with this soon, but for now, we just want to work on doing a good job of pushing on the chest. This means you'll be doing more compressions in a row for this practice than you would for a regular sequence of CPR. See, we want to focus on the most important parts of CPR first. Then we'll put them all together later in the correct number and order. Also, as you practice these skills, it might be helpful for you to say out loud what you are doing step by step. You should be in position to practice along. The video will tell you what to do and repeat a couple of times. Don't worry, I'll tell you when to rotate so that everyone gets a chance. You should already be kneeling at the victim's side. So get ready and begin. Quickly move or remove all clothes from the front of the chest that will get in the way of doing compressions and using an AED. Put the heel of one hand on the center of the chest between the nipples. Then put the heel of the other hand on top of the first. When I tell you, keep time with the beat, pushing straight down on the victim's chest. Remember to push hard and push fast. After each push, release pressure on the chest to let it come back to its normal position. Get ready and begin. Push hard and fast. As you keep time with the beat, you're pushing at the rate of 100 compressions a minute. After each push, let the chest come back to its normal position. Great. Good job. Now you know how to perform compressions. If you're at the mannequin, just stay put and relax, because next we'll learn another part of CPR, opening the airway and breathing. Before we get a chance to practice, though, your instructor will pause the video to teach you how to make sure the mannequin is clean before each person uses it. Now we're going to learn another part of CPR, opening the airway and breathing. To open the airway, we do something called the head tilt chin lift. To do this, tilt the head by pushing back on the forehead. Then, lift the chin by putting your fingers on the bony part of the chin and lift the jaw to bring the chin forward. This will lift the victim's tongue from the back of the throat. However, it's important not to press into the soft tissue of the neck or under the chin because this might block the airway. Once the airway is open, your breaths give oxygen to someone when he can't breathe on his own. As you give each breath, you should look down at the victim's chest to see it rise. Actually, seeing the chest rise is the best way to know that your breaths are effective. So, here's your chance to practice opening the airway and giving breaths along with the video. Now, we're only focusing on giving good breaths, so we'll do a lot more of them at one time than you usually would with CPR. Whoever practiced last should already be in position, so you get to go first this time. Your instructor will pause the video between each practice to allow you to switch out, so everyone will get a chance to practice. Get ready and begin. First, open the airway with a head tilt chin lift. Pinch the nose closed. Take a regular, not a deep, breath. Cover the victim's mouth with your mouth and give a breath blowing for 1 second. Give a second breath. Watch for chest rise as you give the breath. Continue practicing until you're told to switch. Give a breath. Watch for chest rise. Give a breath. Give a breath. Give a breath. Watch for chest rise. Give a breath. Give a breath. Give a breath. Watch for chest rise. Give a breath. Give a breath. Did you see chest rise? Give a breath. Great. Now that you know how to do compressions and breaths, let's put them together. I'll go over some details first, then we'll practice. Whoever wound up last on the mannequin, stay put. You'll be the first this time when we practice. When you give CPR, you give sets of compressions and 2 breaths. This is the actual number of compressions and breaths for CPR, so we'll be counting out loud as we go from now on to keep track. Also, after you give the second breath, it's very important to go right to pushing on the chest.
1, 2, 3, 4.
Do
5,
this immediately
6,
after
7,
the second
8,
breath as
9,
fast as you
10,
can.
11, 12, 13.
So practice along now, counting out loud, as we combine both steps into one sequence. And remember to push hard and push fast, at the rate of 100 beats per minute. After each push, release pressure on the chest to let it come back to its normal position. When you give breaths, watch for chest rise. Whoever practiced last should be in position to start. Get ready? Now begin. First, start with compressions.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Do a head tilt chin lift and give 2 breaths. Repeat.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Great. Now you know the two most important parts of CPR, pushing on the chest and breathing. Next, let's take a look at the steps that lead up to doing CPR. If you're at the mannequin, sit back and relax while we go over the details. I'll tell you when to get ready to practice in a moment. Before you start doing CPR, you need to make sure the scene is safe for you and the victim. Be aware of anything that could put either of you in danger while you help. You can't help if you become a victim too.
The scene is safe.
Next, you need to assess the victim by checking to see if he or she responds. Kneel at the victim's side, tap them, and shout loudly, "Are you okay?"
Are you okay? Are you okay?
If the victim does not respond, yell for help.
Help! I need some help.
If someone comes near, send him to phone the emergency response number and get an automated external defibrillator, or AED, if available.
Call 911, get an AED.
You'll learn about AEDs a little later. If no one comes, however, you'll have to call the emergency response number and get the AED yourself, then return to the victim. Open the victim's airway with a head tilt chin lift and check to see if the victim is breathing normally. Put your ear next to the victim's mouth and nose. Look to see if the chest is moving. Listen for breaths and feel for them on your cheek. Do this for at least 5 seconds, but no more than 10 seconds. You don't want to delay compressions and breathing any more than you have to. If there's no normal breathing, give 2 breaths over 1 second each. Watch for chest rise as you give each breath. Okay, now let's practice the first steps of CPR. We're just going to do the first steps, then add the rest soon. So first of all, we're going to make sure the scene is safe. Since we're only practicing in a classroom, you can just say out loud, "I'm making sure the scene is safe." Next, we'll assess the victim and give 2 breaths. Practice along with the video and switch out when I tell you to. Whoever was on the mannequin last should be in place to go first. Get ready and begin. First, make sure the scene is safe for you and the victim.
The scene is safe.
Then, tap and shout to see if the victim responds.
Are you okay? Are you okay?
If the victim does not respond, yell for help.
Help! Help! I need some help.
If someone comes, send him to phone the emergency response number and get the AED.
Call 911, get an AED.
Then open the airway with a head tilt chin lift. Check to see if the victim is breathing normally. Look, listen, and feel for breaths for at least 5 seconds, but no more than 10 seconds. If the victim is not breathing normally, give 2 breaths and watch for chest rise. Okay, that's how you assess a victim. Now you've seen all the steps that make up a sequence of CPR. It's not that hard after all, is it? Well, right now we're going to show you some special things to consider when doing CPR. Then we'll watch a full sequence of CPR put together. If you're at the mannequin, you can sit back, relax, and watch the video. I'll tell you when it's time to practice again. Sometimes a person who doesn't respond may only gasp in the first few minutes after sudden cardiac arrest. Gasping is not breathing. When you open the airway to check breathing and the victim gasps, continue the steps of CPR right away. You should be able to give a good breath since you've practiced. However, if you have a hard time making the chest rise after your first breath, you need to open the victim's airway with a head tilt chin lift before giving the second breath. Just remember to go straight to compressions after the second breath, even if it doesn't make the chest rise. Do not
1,
stop compressions
2,
except for
3,
a few seconds
4,
to give
5,
breaths
6,
or use an
7,
AED.
8, 9, 10, 11, 12, 13.
If the victim is breathing normally but is not responding, roll him onto his side and wait for trained help to take over. Great. We've covered all of the steps of CPR. Now we're going to show you a full CPR sequence put together. Oh, and you still don't have to practice yet. You'll get a chance to practice it all soon, but for now, just watch. First, make sure the scene is safe for you and the victim.
The scene is safe.
Then, tap and shout to see if the victim responds.
Are you okay? Are you okay?
If the victim does not respond, yell for help.
Help! I need some help.
If someone comes, send him to phone the emergency response number and get the AED.
You! Call 911, get an AED.
Then open the airway with a head tilt chin lift. Check to see if the victim is breathing normally. Look, listen, and feel for breaths for at least 5 seconds, but no more than 10 seconds. If the victim is not breathing normally, give 2 breaths and watch for a chest rise. Quickly move or remove clothes from the front of the chest that will get in the way of doing compressions and using an AED.
1, 2,
Now,
3,
give 30
4,
compressions at a
5,
rate of
6,
100 per
7,
minute.
8, 9, 10,
Push
11,
hard
12,
and push
13,
fast.
14, 15, 16,
After each
17,
push,
18,
release
19,
pressure on the
20,
chest, let
21,
it come back to
22,
its normal
23,
position.
24, 25, 26, 27, 28, 29, 30.
Then, give 2 breaths and watch for chest rise. Keep giving sets of 30 compressions and 2
1,
breaths
2,
until an
3,
AED
4,
arrives,
5,
the
6,
victim starts
7,
to move,
8,
or trained
9,
help takes
10,
over.
11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, so far you've seen all the steps of CPR for adults. You've also practiced each step separately. Here's your chance to put all of them together, practicing along with the video. You're going to start by making sure the scene is safe. You'll then check for a response. Yell for help. Check for normal breathing. Give 2 breaths, and give 5 sets of 30 compressions and 2 breaths. Remember, push hard and push fast. After each push, release pressure on the chest to let it come back to its normal position. When you give breaths, watch for chest rise. Do not stop compressions except for a few seconds to give breaths or use an AED. Get ready and begin. First, make sure the scene is safe for you and the victim.
The scene is safe.
Tap and shout to see if the victim responds.
Are you okay? Are you okay?
If the victim does not respond, yell for help.
Help! I need some help here.
If someone comes, send him to phone the emergency response number and get the AED.
You, call 911, get an AED.
Then open the airway with a head tilt, chin lift. Check to see if the victim is breathing normally. Look, listen, and feel for breaths. If there is no normal breathing, give 2 breaths that make the chest rise for 1 second each. Quickly move or remove clothes from the front of the chest that will get in the way of doing compressions
1, 2,
and using
3,
an AED.
4, 5, 6, 7, 8,
Now, give
9,
30 compressions.
10, 11, 12, 13, 14,
Remember to
15,
push hard
16,
and push
17,
fast.
18, 19, 20, 21, 22, 23,
Let the chest
24,
return to normal.
25, 26, 27, 28, 29, 30.
Then give 2 breaths. When you give breaths, watch for chest rise.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
All right, now you've practiced all the steps of CPR for adults. Good job. But you know, there are a few special differences to keep in mind when you're doing CPR on children, ages 1 to 8. So let's take a look at those now. This is another chance to sit back and watch, but you'll get a chance to practice soon. If you're alone and find a young child who doesn't respond, you'll need to perform 5 sets of 30 compressions and 2 breaths before you phone for help. When giving breaths to children, open the airway and give breaths that make the chest rise, just like for adults. For small children, you will not need to blow as much as for larger children or adults. You won't need to push as deep for compressions either. Press down 1/3 to 1/2 the depth of the chest for children. After each push, release pressure on the chest to let it come back to its normal position. Also, when giving compressions on very small children, you may just need to use only one hand. So let's see what an entire sequence of child CPR looks like on a child age 1 to 8. Again, you're just going to watch this time, but pay close attention because you'll get a chance to practice what you've learned soon. First, make sure the scene is safe.
Okay, the scene is safe.
Then tap and shout to see if the victim responds.
Are you okay? Are you all right?
If the victim does not respond, yell for help.
Help! Someone help!
If someone comes, send that person to phone the emergency response number and get an AED.
You call 911 and get an AED.
You stay with the child. Open the airway with the head tilt, chin lift. Check to see if the victim is breathing. Look, listen, and feel for breaths. Take at least 5 seconds, but no more than 10. If the child is not breathing, give 2 breaths for 1 second each. And watch for chest rise as you give each breath. Quickly move or remove all clothes from the front of the chest that will get in the way of doing compressions and using an AED.
5, 6, 7, 8.
Give 30
9,
compressions
10,
at a rate of 100 per
11,
minute,
12, 13,
then
14,
give 2 breaths
15, 16,
and repeat for a
17,
total of
18,
5
19,
sets.
20, 21, 22, 23, 24, 25,
Push hard
26,
and push
27,
fast.
28, 29, 30.
Let the chest return to normal.
One, 2, 3, 4, 5, 6, 7, 8.
Again, if you are alone and are giving CPR to a child,
1, 2,
do
3,
5 sets
4,
of 30
5,
compressions
6,
and 2
7,
breaths.
8, 9, 10, 11,
Then
12,
leave the child to
13,
phone the
14,
emergency response
15,
number
16,
and get the
17,
AED.
18, 19, 20,
Keep
21,
giving sets of 30
22,
compressions
23,
and 2
24,
breaths
25,
until an
26,
AED
27,
arrives,
28, 29,
the victim
30.
starts to move, or trained help takes over. Congratulations! You've just learned all the steps of CPR for adults and children over 1 year of age. You've also learned special considerations for both adults and children as well. Wasn't so hard after all, was it? Well, here's your chance to practice all the steps in order. The following scenes show a variety of emergencies. It will be up to you to take turns showing how you would respond to them. Use the practice sheets in your workbook while you practice. Your instructor will guide you.
You go to check on your neighbor who lives alone. You find him lying on the floor and you see a phone nearby. Show what you would do.
I need help.
You are at a movie theater and hear a call for help. You find a man lying on the floor. You have a cell phone. Show what you would do. You are walking in the park and find a woman lying on the ground. You have a cell phone. Show what you would do. You are babysitting a 5-year-old. You find her lying on the floor. There is a phone nearby. Show what you would do.
Help! Help! Someone! Please! My little brother!
You are at a campground and hear a cry for help. You find a 4-year-old lying on the ground. There is a phone at the camp office. Show what you would do.
Please, can anyone help me? Please, can anyone help me?
You are at a playground and hear a call for help. You find a 4-year-old boy lying on the ground. You have a cell phone. Show what you would do.
Well, you should be proud of yourself. You just learned how to provide CPR for adults and children age 1 and older. You've learned that one of the most important parts of CPR is compressions, pushing hard and fast to pump blood through the body and to the brain. You've learned how to open the airway and give breaths. You've learned how to make sure a scene is safe. And you've learned how to put it all together in order to give a victim the best chance for survival. And remember, even though you've only practiced a certain number of sets of 30 compressions and 2 breaths, in real life, you continue CPR until trained professionals take over. And for children, always do 5 sets of CPR before calling the emergency response number yourself. But most importantly, you've learned that you can make a difference when it comes to saving someone's life. You know, during CPR, there's very little chance of catching a disease. However, some regulatory agencies require that certain rescuers use a barrier device, such as a mask, when giving breaths in the workplace.
28, 29, 30.
You may also want to use a mask or other barrier device when giving CPR to someone who is not a family member. Masks are made of firm plastic and fit over a victim's mouth or mouth and nose. You may need to put a mask together before you use it. It's easy, just pop it into shape and attach the one-way valve that goes with the mask. That's the part you breathe into. There are different sizes for adults, children, and infants, so make sure you're using the right size for the victim. Doesn't look hard, does it? Well, get ready, because we're now going to practice breaths using a mask. Follow along with the video as before, making sure to watch for chest rise as you give breaths. We'll show you how to place the mask, then give you a chance to practice giving breaths several times in a row. If you're already at the mannequin, you'll go first. So, here we go. Get ready. Now begin. If the mask isn't round, put the narrow part of the mask on the bridge of the nose. The wide part of the mask should cover the victim's mouth. Tilt the head and lift the chin while pressing the mask against the victim's face. It's important to make a good seal between the victim's face and the mask while you lift the chin to keep the airway open. Give 2 breaths while watching for chest rise. Actually seeing the chest rise while giving breaths is the best way to make sure your breaths are effective. Now, continue to practice giving breaths until I tell you to switch. Give a breath, watch for chest rise. Give a breath, give a breath, give a breath, watch for chest rise. Give a breath, give a breath, give a breath, watch for chest rise. Give a breath, give a breath, Give a breath. Watch for chest rise. Okay, now let's try putting compressions and breathing with a mask together. If you were the last one to practice on the mannequin, stay put. You'll go first. We're going to practice along with the video as before, combining 2 sets of 30 compressions and 2 breaths. Only this time, we'll use a mask. Remember to keep the mask tight around the victim's face so that your breaths make the chest rise. Push hard and push fast. After each push, release pressure on the chest to let it come back to its normal position. When you give breaths, watch for chest rise. We'll start with compressions. Get ready and begin.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Now, do a head tilt chin lift and give 2 breaths with a mask. Repeat.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Great job. And that's how you do compressions and breaths for CPR using a mask. When someone's heart stops pumping blood, the earlier you give CPR, the better the chance for survival. But CPR isn't the only answer. Sometimes a victim who does not respond may have an abnormal heart rhythm. This may stop the heart from pumping blood. The best thing to do for an adult is to start CPR right away and use an automated external defibrillator, or AED, as soon as it arrives. Delivering an electric shock to the heart might allow a normal heart rhythm to return. An AED is a machine with a computer inside that can recognize cardiac arrest that requires a shock, tell when a shock is needed, and give a shock when it is needed. There are many brands of AEDs, and although they may differ slightly, the same basic steps operate all of them. The AED will prompt you with voice prompts, lights, or text messages. You should use an AED on a victim age 1 and older only when that person does not respond and is not breathing. For victims 8 and older, start CPR right away and use the AED as soon as it's available. For victims 1 through 8, give 5 sets of 30 compressions and 2 breaths, about 2 minutes before attaching and using the AED. There is currently not enough data for the American Heart Association to recommend for or against using AEDs in infants less than 1 year of age. AEDs can work on both adults and children. You can find information on using AEDs for a child on your CD. If the AED has different sized pads, always use the larger adult pads for victims 8 and older. Let's watch how to use an AED.
The scene is safe. Are you okay? Are you okay?
If you have a victim who does not respond and someone else is available, send him to phone for help.
Help, I need some help here. Call 911, get an AED.
While they go to phone for help and get the AED, continue the steps of CPR. Keep in mind that if no one comes to help you, you'll have to phone for help and get the AED yourself.
11, 12, 13, 14,
Use the
15,
same 4
16,
simple
17,
steps to
18.
operate all AEDs. First, turn the AED on. Push the on button or open the lid.
Attach pads to victim's bare chest.
The AED will prompt you through the steps, but remember you must first turn the AED on. Choose the correct pads. Then open the pad package and peel away the plastic backing. Attach the sticky side directly to the victim's bare chest. Follow the pictures on the package or pads.
Plug-in connector.
Next, clear the victim by making sure no one is touching them while the AED checks the heart rhythm.
Checking clear the victim.
Clear.
If the AED finds a heart rhythm that can be helped with a shock, the AED will tell you so.
Shock needed Charging.
The AED will then tell you when to push the shock button.
Clear the victim.
Clear.
Press the shock button.
When the shock is delivered, the victim's muscles may jerk. If the AED tells you no shock advised, follow the prompts.
Start CPR. Begin with compressions.
1, 2, 3, 4, 5, 6, 7, 8, 9.
Okay, your instructor will now explain how to operate the AED trainer you're going to use today. And don't worry, it can't really give a shock. Afterwards, you'll get a chance to show what you've learned. Okay, here's your chance to practice using an AED. You're each going to see a scene showing an AED emergency. It will be up to you to demonstrate how to respond. After your turn, the next student will get their chance watching another scene. Use your practice sheets. Your instructor will guide you.
You find a man lying next to the hotel swimming pool. An AED and phone are nearby. Show what you would do.
Oh no, Anna, are you okay? Are you okay, baby? Help!
You are at a shopping mall and hear a woman yell for help for her 12-year-old daughter. Other shoppers arrive with a cell phone and there is an AED nearby. Show what you would do. You are working on a job and find a co-worker lying on the ground. You have a cell phone and there is an AED in the office. Show what you would do.
Okay, here's your chance to practice using an AED. You're each going to see a scene showing an AED emergency. Remember, push hard and push fast. After each push, release pressure on the chest to let it come back to its normal position. When you give breaths, watch for chest rise.
John!
You are watching your company softball game when one of the players collapses. There is an AED available and a cell phone is nearby. Show what you would do.
There we go. Yeah. Help!
You are watching a football game and hear someone yell for help. You find a man lying on a bleacher. A phone and an AED are available in a nearby concession stand. Show what you would do. You're working late at the office when a coworker collapses. A phone and an AED are nearby. Show what you would do.
Help!
Please,
Someone,
somebody!
please help us!
Please.
You are walking through a park and hear someone yell for help. You arrive to find a 6-year-old boy lying in the path. An AED and a phone are in the nearby park office. Show what you would do. You are at the local library and find a 5-year-old child lying on the floor. A phone and an AED are at the checkout desk. Show what you would do.
I need help!
You are at a movie theater and hear a call for help. You find a 7-year-old girl lying on the floor. An AED and phone are in the manager's office. Show what you would do.
At this time, your instructor will evaluate the CPR and AED skills of each of you.
As you enter a hotel workout room, you find a man lying on the floor. There are other guests in the room, and a phone and an AED are at the registration desk. Show what you would do.
Just like with CPR, special situations will change the way you use an AED. Sit back and watch while we go over them now. You'll need to watch out if the victim is covered in water, the victim has a medication patch, the victim has an implanted pacemaker or defibrillator, the victim has a hairy chest. Do not deliver a shock when a victim is lying in or covered with water. Water on the victim's chest could cause the shock to flow over the skin from one pad to the other. If that happens, energy won't go to the victim's heart. If someone is lying in water or the chest is covered with water, you should quickly move the victim from standing water and wipe the chest before attaching the AED pads. If the victim is lying in a small puddle of water or snow, but the chest is not covered with water, you can give shocks. Some people have a medicine patch in the same place where you would put the AED pad. A patch like this may block some of the shock dose so that it does not reach the heart. It may also burn the victim. Take the patch off while wearing gloves and quickly wipe the chest before you put on the pad. Some children or adults may have an implanted pacemaker or defibrillator. These devices make a hard lump under the skin of the chest or stomach. The lump is smaller than a deck of cards. These devices will block delivery of some of the shock to the heart, so if you see this lump, put the pad at least an inch away. Finally, if a victim has a hairy chest, the AED pad may stick to the hair instead of the skin on the chest. If this happens, the AED will not be able to check the victim's heart rhythm or deliver a shock. The AED may give a warning. If this happens, press both pads down more firmly. If the AED still tells you to check the pads, quickly pull off the pads to remove the hair. If a lot of hair remains where you will put the pads, shave the area with a razor in the AED case. Then, put on a new set of pads.
Hey there, Coach.
Hey, Sonny. It's good to have you back.
It's good to be back, I can tell you that. You know, Coach, I really want to thank you for taking care of me that day. You know, you saved my life.
I just did what needed to be done, that's all. You would have done the same for me, I know it.
Well, it's only right, I suppose.
How do you mean?
Well, I've been whipping your office into shape all these years. I suppose it's only fair you whip me into shape once.
Well, I guess you're right. Hey, I'll see you tomorrow, okay?
Yes, sir. You can count on it.
All right.
Okay, congratulations on learning how to use an AED. A person who has sudden cardiac arrest will have the best chance for survival if you give the victim immediate CPR and use an AED within a few minutes. Now you know what an AED does and when to use one, and how to list all the steps in using an AED. You can see how an AED is a very important tool when it comes to helping someone recover from sudden cardiac arrest. Congratulations! This concludes the American Heart Association's Heart Saver First Aid course. Remember, being able to give CPR effectively and knowing how to use an AED can help save someone's life. You can make a difference.